What does a brain MRI or CT scan reveal about stroke? Imagine a quick glimpse inside the brain that can tell doctors what kind of stroke someone might be having. That's what brain imaging tests like CT scans and MRI scans do. When a person shows signs of a stroke, these images are crucial for figuring out what's happening inside the brain. A CT scan uses X-ray technology to produce detailed pictures of the brain. It is usually the first test done because it is fast, widely available, and can be performed quickly in emergency situations. The main strength of a CT scan is its ability to detect bleeding in the brain, known as a hemorrhagic stroke. This is important because bleeding requires different treatment than a stroke caused by a blood clot. A CT can show bleeding almost immediately, which helps doctors decide on the best course of action. It can also identify early signs of an ischemic stroke, which happens when a blood clot blocks blood flow. These signs might appear as darker areas on the scan, indicating tissue damage, but sometimes these changes take several hours to show up clearly. Besides stroke, a CT scan can also rule out other issues like tumors or infections that might cause similar symptoms. On the other hand, MRI scans use magnetic fields and radio waves to create very detailed images of the brain. They are especially good at detecting ischemic strokes early, often within minutes to an hour after symptoms start. This is because MRI, especially with a technique called diffusion-weighted imaging, can see areas where water movement in the brain is restricted due to cell injury. This makes MRI much more sensitive in catching early brain damage caused by a stroke. MRI can also show the exact location and size of the stroke, whether it's bleeding or tissue damage, and can give information about blood flow issues. It can even help identify blood clots and the affected blood vessels. In summary, CT scans are quick and excellent at spotting bleeding in the brain, making them the first choice in emergencies. They can also show signs of ischemic stroke after some hours. MRI scans are more sensitive and can detect early ischemic damage within the first hour, providing detailed information about the extent and age of the stroke. Both tests work together to give a complete picture, guiding treatment decisions. For example, if a blood clot is found early, doctors might use clot-busting medications. But if bleeding is detected, those medications are avoided. Accurate imaging helps predict how well a person might recover and what treatments are safest and most effective. Always remember, if you or someone else shows signs of a stroke, seeking immediate medical attention is vital. Only healthcare professionals can interpret these images correctly and decide on the best treatment plan.